The name of the program is the Premium Assistance for Employees of Child Care Facilities. No fancy acronym, but essentially the legislature provided some funding to wrap around premiums for employees in licensed child care facilities who purchase coverage through Washington Health Plan Finder, which is the portal that the Washington Health Benefit Exchange runs. About 1 in 4 Washingtonians use our website to connect to either public coverage, Washington Apple Health coverage, or Medicaid coverage here in the state, or qualified health plan coverage, which is our marketplace coverage. So this program was designed to cover people who are just over income eligibility limits for Washington Apple Health or Medicaid, and who are under 300% of the federal poverty level. So childcare workers and professionals who are eligible for Medicaid, we facilitate them into that program. If they're over 300% of the federal poverty level, we facilitate them into qualified health plan coverage with or without federal tax credits. And then if you fall in that sweet spot between 139 and 300% of the federal poverty level, you can get a $0 premium plan for the duration of the program.
And I think one of the things that I would add that I think is unique about some of this is that this isn't really just about the owner operator or the teacher in the classroom, right? This is really looking at the individuals in that facility, whether it's a licensed family home, a center, outdoor preschool. So really just, again, looking across the variety of provider types and the variety of staff that are in those settings.
DCYF sort of starts it by contacting the child care professional and saying, this is a new service, a new program in Washington. That employee or professional is encouraged to contact Yakima Neighborhood Health Services, either through email or phone. And then Yakima, our navigators at Yakima will follow up and help them complete an online application and submit it. And to the extent that they're eligible to purchase through Health Plan Finder, they're either connected to the free and low cost care they may already be eligible for, and they don't know it. We've seen, over 1,000 people kind of newly qualify for the Washington Apple Health or Medicaid program. So just with the help of connecting them to an assister who then helps them apply for care, we've connected people to care that they were probably already eligible for, that's free. And then for the people who fit in this sort of FPL band that the state was able to fund, they make sure they get in the right plan to get them that $0 premium. And then if they're over income, they help them pick a plan that may be available to them that right now, because we have such generous federal subsidies available under the American Rescue Plan Act that passed as part of the COVID pandemic response efforts, half of our enrollees are getting plans for under $100, under $50, under $10. Our state-based marketplace has a portal. Washington Health Plan Finder is the sort of front door for all of the sort of health, multiple different available health coverage programs. So if you come to Washington Health Plan Finder, you apply for health insurance, we connect you automatically to whatever program you're eligible for. So if you're Medicaid eligible, we automatically enroll you into that program, which then gets administered by our Medicaid agency. If you're eligible for a qualified health plan, we connect you with that plan and the available federal and state assistance you may be eligible for. And then those are administered by private health carriers. So we sort of sit in a space where the good news is if you come through the front door, most people don't know which program they're eligible for. We help you fill out an application, we get you the information you need, and then we're connecting you to Medicaid or this new child care premium assistance or federal assistance that you might be eligible for. So I think I'm looking at my cheat sheet here, but there is, over 10,500 childcare professionals that work in DCYF licensed facilities are currently on Medicaid. And, there's about 1,300 of them have gotten newly covered recently, sort of since we've launched this program and sort of increased the outreach and the awareness and tried to kind of really connect the healthcare sphere and the childcare sphere together. We did a pilot program sort of in response to advocacy interest and legislator kind of preliminary interest in advance of sort of the legislative session, where we partnered with Yakima Neighborhood Health Services and just opened up their services to any interested childcare provider to give free enrollment assistance to people who work in childcare facilities and are interested in learning more about healthcare. And so that was with no dollars attached. And we saw that people were coming in. Of the 200, 300, 400 people who came through, about 70% of them were eligible for the Washington Apple Health Medicaid program. So we had a sense that there was a large percent of this population who could be eligible for free and low cost care already. And I think investing in the program and investing in the outreach and investing in kind of the partnership and the data sharing and sort of putting some structure around that relationship to kind of drive the outreach around this program did bring people who were eligible for Washington Apple Health. And then when we launched this new program, we saw, 50% of the people come in and keep going to Medicaid, and 50% came in and sort of are benefiting from this marketplace coverage. These are often childcare professionals don't necessarily have a connection to the exchange. They haven't necessarily shopped for health insurance through the state-based marketplace before. And the data sharing component between the two entities has been really important, because DCYF can tell us, hey, here are the 40,000, employees at licensed childcare facilities in the state. And we can turn around and tell them back, 12,500 of these people have coverage through Washington Health Plan Finder already. So they have a known source of coverage, and let's do what we can together to target the remaining employees who don't necessarily have a known source of coverage. And some of those people may have employer coverage, they may be covered by a spouse or a partner, but some may be the exact people that we're targeting with this program. And we can see with our metrics, DCYF pushes out an email reminding people about the availability of this program, or they push out messaging to new people who are kind of newly licensed and joining the workforce in Washington. And that messaging directs them to a statewide outreach and enrollment partner that the exchange works with. We work with Yakima Neighborhood Health Services. They're one of our lead navigator organizations, but really in any state, it could be any entity that helps you do statewide outreach and enrollment for your healthcare. And they push out an email, and we see the calls and the emails spike at Yakima. So we can see that it's making a difference to do sort of repeated and continuous outreach from a more trusted state partner in this area. We're also working with local brokers and assisters and sort of our community engagement partners that we routinely work with around healthcare to help spread the word. But the partnership of DCYF pushing out messaging, and then Yakima Neighborhood Health Services following up with people, doing proactive outreach, helping people who call get through a healthcare application, which isn't necessarily the easiest application, really providing that kind of on the ground experience, providing language assistance services. They support over 200 languages, which has been pretty important. We look at the population of people who are being served by this program right now, and 22% of them have a non-English language preference. So I think there's been having sort of bilingual, multilingual, and telephonic interpreter services available has been a key learning as an important part of the outreach that they're doing.
So we do work really closely on outreach. And so one of the things that we do, and this is maybe a little too in the weeds, but anybody who passes a background check is actually getting outreach. So we're, again, looking at that facility and provider type. And if they've passed a background check, we are communicating with them to let them know that this is available to them. There were some initial outreach that happened in September. And we now send monthly communications to folks. And so really worked in the beginning with our partners at the Health Benefit Exchange to really identify sort of who we were going to be communicating with and working on that communication flow. And then I think one of the things that's been great about working with the Health Benefits Exchange is sort of as they're seeing who's coming through the door, they can reach out to us and say, hey, we want to do another push of communication. Let's think about how we might actually get to some of those actual employer and the directors and our trusted partners who can give some more information to those individual staff. And we're actually right in the middle of working on a campaign around that right now. So we have reached tens of thousands of childcare providers through that outreach. And then I think the other piece that Joan can talk about is just the importance of the navigator. So I think DCYF sending that initial outreach is really important, but I think we know sort of that personal follow-up and connection is also really important.
I will add that one thing that we've offered to employers in the childcare space is to have a local navigator come to their workplace and or set up kind of individual appointments, sort of on the clock appointments, where an employer can kind of make space for their employee to talk to a navigator to do the work of signing up kind of during their workday or as part of their workday, so that it's not necessarily on the employee to try to find time in their day or kind of do it later at night. So that's one kind of idea that we think has been helpful, is that if you have an employer who wants to help their employees get covered and wants to carve out time for them during the day to do that, we can make a local navigator or assister available during that time to try to help streamline that process even more. So this has been a really insightful experience for us in terms of lessons learned in reaching out to communities and to sort of providing and gaining community trust around a new program that's providing a pretty substantial amount of premium assistance. We've had some childcare workers, say like, this is too good to be true. This program must be a scam. Or it's like, oh, sure, I get 2 months free and then you charge me later. We've had our outreach workers have reported back to us that really trying to figure out how to sell and market healthcare to an audience that doesn't necessarily know who you are and what you're selling in this space can be really challenging. The initial investment was a combination of different pots of federal money. There were $25 million in CRISA funds that were allocated to the program that expire in September of 2022. And there were $5 million in American Rescue Plan Act, or ARPA dollars, that were intended to fund the program for the last quarter of the calendar year from September through December. So there was initial investment of $30 million. I would say that that would enable us to cover up to 10,000 child initial estimate. If you structure a program where it wraps around the available federal financial assistance in your state, it does not need to be that expensive to either the state or the funder who's making the money available. So what we saw, with the 400 people that we are covering right now, because the federal subsidies are so generous, that all-in cost, is going to end up being around 1.5 million to 2 million a year. And so you are able to provide really impactful healthcare coverage for a relatively low cost to the state because of the federal subsidies that are available right now through the federal marketplaces. So didn't want anyone to think that this is like a $30 million level of investment. You can cover hundreds of people for a few $1 million if it's states are looking to sort of look to their own state budgets to try to fund this type of work.
No, and I think it's a really good point about sort of level of investment and, why healthcare in Washington state. I think there's a couple of pieces of history that are important. And one is that our licensed family child care providers in Washington state that accept Working Connections child care subsidy are eligible for health care through their collective bargaining agreement with Service Employees International Union 925. And so you've got about another 700 or so providers who access that form of healthcare, but that is available only to the owner operator. And I think, the pandemic certainly highlighted the need for healthcare coverage for our frontline workers and our childcare providers who actually in Washington state never shut down and remained open during this entire time. And so we've also looked at this from the perspective of compensation, not being just about wages, but about being sort of what is that whole package of benefits. And so I think there was lots of conversation happening sort of pre-pandemic. Pandemic highlighted it a little bit more. And then you had some very active advocates. We have an active center association here in Washington state and others who are really coming together. I'm talking with DCYF, talking with Health Benefits Exchange, our Office of Financial Management, our governor's policy staff saying this is a real need. At the same time, we also have the Washington State Child Care Collaborative Task Force, which is meant to look at a variety of different things related to childcare.
I think at the Health Benefit Exchange, we have sort of a pretty bold equity statement, and we've been leaning into social determinants of health and really trying to look at what are all the facets that make someone healthy and what are all the things in their environment that prevent them from being healthy. So these kind of programs where you're looking not just at access to healthcare, but also affordability of healthcare, and also barriers, language access barriers, accessibility issues, health literacy barriers, where you're looking kind of holistically at someone, trying to meet them where they are and trying to get them connected to healthcare. That is sort of a broad health equity, social determinants work that our board feels pretty passionately about, that this kind of initiative fits squarely into. So it's been an exciting fit in terms of fitting a broader equity strategy. More specifically, this program brings people's premiums down to zero. I think there was an acknowledgement that for some people, paying a partial premium is a barrier. So I think that was one key component. I think making sure that there was free enrollment assistance available was part of trying to make sure the program could be accessed in an accessible way, and then providing the additional kind of language access, disability access services as part of providing one-on-one assistance to people. I think is something that we're, in looking at it with an equity lens, we wanted to try to make sure that could make the program as broadly available as possible. I think with the work of DCYF, we've done a lot of translations of materials they mentioned between the sort of interpretive services and translated services, really trying to make sure that we're meeting people where they are, and really trying to make sure our call center and our navigator organization has evening hours and is working during lunch to provide people an opportunity to access the service was also important to us.
I think I would just go back to, again, we know that our childcare provider population is disproportionately women and women of color, and that when we think about wages and compensation for childcare providers, we have, as Joan has sort of highlighted, many of them are actually eligible for public assistance and other benefits, right? And so how are we really making sure that they are getting access to something that they really need, and it's being done in a supportive way, as Joan noted, meeting them where they are. And I think the navigators and the language access piece are huge. And I think we've been able to learn from each other about how to do that. And I think this, again, really also, I think helps DCYF meet our racial equity and social justice goals related to making sure that providers are reflective of the kids and families that they're serving. And part of that means you need to be thinking about what is the compensation, benefits, and access to healthcare and other pieces they need in order to be able to stay and do that work.